Hello everyone. In this video, I am going to talk about pyromania. Let's see about pyromania. What is pyromania? The pyromania is a type of impulse control disorder that is characterized by being unable to resist starting fires. People with pyromania know that setting fire is harmful, but setting fire is the only way they can relieve their built up tension, anxiety, or arousal. Definition of pyromania is an impulse control disorder in which people cannot restrain themselves from acting on strong and compelling urges of intense desire to prepare, set, and watch fires. So it is a deep desire for fire to start fires for relief, pleasure, and or gratification. So this feeling for fire can grow over time if not treated. Pyromania comes under Axis 1 disorder. So no elsewhere classified this disease. And the prevalence. So it's a rare condition. Pyromania is apparently rare. Major problem in children and teens. Over 40% of arrests due to fire-related cases are under the age of 18 years old. It's more common in males. It's more commonly men with poor social and learning difficulties. And the etiological fact is past history of alcohol dependence and or abuse and childhood neglect. So since their early years, mainly due to the reason of negligence coming from their parents and people with low self-esteem, depression, communication problems, and inability to control anger. Many kids with pyromania many of the times have more than one disorder. Then essential features of pyromania: deliberate fire setting on multiple occasions, not for money, anger, or to cover up a crime. Also, it's not caused by delusion or hallucination. So mainly it's fascination with and attraction to fire and anxiety. So here the anxiety before setting a fire and relieved after the fire is set. Isolation. So isolated from community and family and running away from home. So mostly these pyromania patients will have wandering behavior also. And the associated features are they will experience intense pleasure and relief while next to fire. They will have urges to start firing. It is irresistible. Interested in anything that is fire related, like a firefighter. So normally they will have more than one disorder, like antisocial personality disorder, chronic depression, and mental retardation. Deliberate and purposeful fire setting on more than one occasion. Tension or affective arousal before the act. So the fire setting is not done for monetary gain or for any other type of political reason. Then prognosis. The prognosis of a recovery in children who suffer from pyromania depends on the environmental or individual factors involved, but is generally positive. In adults, the recovery rate is generally poor. So if an adult, it usually takes a longer period of time to recover. The treatment modalities are the first line treatment is prevention, and also they offer a variety of therapy like based on behavioral, cognitive, and psychodynamic therapy. Some will intake antidepressants and community outreach program. So through this community outreach program, so we can teach about dangers of fires as well as fire safety programs also we need to conduct in community area. And since pyromania is very rare and scientists are not able to understand it more, but some of the treatment the doctors suggest is problem solving skills, anger management training, and cognitive restructuring. So these are the common treatment modalities for pyromania patients. So by concluding, So we could understand. So this pyromania, it is a mental disorder. It's characterized by a fascination with fire and irresistible urges to set fires. Also, people with pyromania don't set fires for personal gain to satisfy a need for rebellion. Thank you.